Hey, listeners, we're continuing our series of live bonus episodes from Vive and HIMSS, where we sat down with industry leaders about innovations and digital trends that are making healthcare easier. Today, you'll hear from Joe Brennan, VP of Provider Solutions at TytoCare. Let's get to it.
All right, Joe. Can you introduce yourself a little bit?
My name is Joe Brennan. I'm Vice President of Provider Solutions for TytoCare.
So tell us about TytoCare. Where's the company these days? Like, how long has it been around, and what areas do you focus in?
TytoCare started in 2012, but received FDA clearance in 2016, so we consider that really the start here in the United States. But essentially, it is a platform that includes a device that allows a virtual provider to do a full examination while the patient is in-home or in a non-clinical setting. So it is a singular device that can become a stethoscope with an attachment, can become an otoscope. It is a derm cam, an infrared thermometer, and all of this allows you to listen to heart, lung, and abdominal sounds, look inside the ear canal, take your temperature, take your heart rate, look inside your throat, and the derm cam can look at any skin issues that you have.
So who do you partner with in terms of like who's administering the any of those services?
So TytoCare's customers are the providers or the payer who has a provider partner. So we don't sell direct to consumer. We enable providers who are already doing virtual care and enhancing what their capabilities are.
We were just talking pre-show, right, of people understanding what options are available as human beings first, not as healthcare leaders first, but as people first. And understanding what that means is so important, and still we don't talk about it enough. Okay, so talk about like how TytoCare gets data, how are you using AI and all of that. It sounds like there's been some advancements in terms of what's going on there.
Correct. So just basics of how this works. You can use the TytoCare device and platform asynchronously, so you can do the examination yourself and then send it to a provider to review it at a later time. So patient goes inside their child's ear, records that video, sends it off, or takes their own sounds of their heart and sends it to a cardiologist. Also, we do it synchronously, so you can schedule a virtual appointment, and while you're having that virtual visit, the provider can then listen to your heart, listen to your lungs, look inside your ears. And so having the capability of both asynchronous and synchronous exams, I think makes a big difference. And so we've been doing that here in the United States since 2016. So when you think of all of those files of heart sounds and lung sounds and images of the inside of someone's ear or their throat, we've been able to use AI to take that huge library of data and create algorithms that are going to help the provider make a better decision. So again, it's not for the patient to self-diagnose,
Sure,
but it's going to help the provider with an additional data point to make that decision and offer the best care to that patient.
Yeah, I mean, you can make the case that that's kind of the best case scenario.
Yes.
You have the convenience of that happening in the home, you have the expertise and the quality of care from a provider, and you have the ability to increase and improve the business process that's happening behind all of that, and the data itself. The really best case scenario feels like, and I think it speaks to the flavor and shape of what we talk about healthcare being consumer-centered anyway. That doesn't necessarily mean it's self-diagnosed or self-treated. A lot of times we still need all these aspects. We just don't want to do it in the setting that makes us nervous. You know, in the hospital where we don't know how much things are going to cost. There are other aspects of that consumer experience that are worth mentioning and being a part of this. So I would guess there are even other things that we don't even know can be diagnosed or detected that we will learn as technology learns from that point.
Yeah, and I think, no one is ever saying that we need to replace providers.
Exactly.
And that's not what this is. It's also, it's not meant to be insulting or intimidating in any way. It's, hey, by the way, we found this. You may want to consider that when you're developing the care plan for this. So it's meant simply to help.
So let's make that connection even more between how that does enable a better patient experience. I think one other thing that has risen to the surface throughout the course of this podcast is how much happens that affects our health and wellness between care episodes. And so being able to plug in anywhere in when we refer to as a patient experience, which does tend to be immediately before and after during the care. And a lot of times that is in a care setting. So I've always thought health at home in any shape or flavor helps us understand and redefine kind of what the overall health consumer experience is, because of the things that can happen in the home, because of the things that can still be involved with the provider, and now we're enabling it with certain types of tech. We're redefining really what a patient experience is kind of where I'm getting to with all of that. I mean, do you feel the same way? Do you feel like this helps us understand better ultimately what health and wellness needs we actually need to be addressing and how we do that?
Well, absolutely. I think to your earlier point, that's the fundamental value proposition of TytoCare is those limitations of virtual care, the limitations you have of seeing a provider while you're sitting at home, is that you don't have the physical exam. And most of the time it's a conversation. When you introduce something like TytoCare, you're now getting the same experience that you would have in that clinical setting, but you don't have to drive anywhere. You don't have to take any time off of work. You're doing it at your convenience.
So what does consumer-centered care look like to you? It's a term we use, but I would say we haven't yet completely defined it ourselves on the show or as an industry. What aspects of healthcare should be centered around that? And I'll back that up by saying, when we refer to consumers, we're just trying to emphasize the fact of what things impact our health and wellness in between care episodes. And so if it's easier to think of it as a patient experience, great, but it's still at the end of the day impacted and influenced by so much that's not happening in a care setting. So, like, is that what consumer-centered means? Does it mean where it's happening or how it's happening? Or I'm just curious, like, what the term even, like, what you think about?
Well, I think at least my team at Tyto, it's meeting the patient where they are, when they want to be met, and how they want to be met. And I think that large health systems, and I do come from a large health system as far as experience, but it's nice to say, but that does generally not the experience. It's, you can come here when I tell you you can. I'm not going to tell you how much it costs until it's already happened, and you're just going to have to deal with that. But I think technology and the iterations of improvement of digital health, that's shifting. So the patient is saying, no, that doesn't work for me. So I'm going to take this alternative path. So instead of going to the huge health system, waiting months in order to get in to see a specialist, or paying the rates that you do in traditional healthcare, and looking for alternatives like direct primary care or concierge medicine, or things that speak to that consumer experience that aren't necessarily built in a box that a health system says, it's a little different, and here you go. It's somebody truly saying, I'm going to put you first, and I'm going to try and make you as healthy as possible.
Well, let's hope we get there. And I think it's an opportunity for us on the show to be aware of really cool things that are happening, true innovation that's happening, that is addressing whether it's products and services that are being designed with a lot more consideration of what needs they're trying to meet from a consumer. Sometimes those are things that aren't even expressed or shared, but that is a need that somebody has. They just haven't shared it with you, but you kind of know. I mean, we're all humans at the end of the day, so that's kind of where we get with that. So appreciate that perspective. Is there anything we haven't mentioned or haven't gotten to yet that you want to make sure listeners hear about?
No, I think it's just a very exciting time within healthcare, and podcasts like this and just the conversation that keeps advancing, just as you said, patient-centered experiences and keeping people healthy rather than treating them when they're sick. And it's just very encouraging.
Really appreciate it, Joe. A great perspective to help us understand, again, what's possible, what's available, and how it gives us hope for different types of care. So thanks for joining us.
Appreciate the time. Thank you.